For thousands of years, people lived in these deserts because the rivers were flowing. In the 1920s and 1930s, the rivers were dammed, and that was to preserve water for the Phoenix area. So when you look at this from not just a healthcare perspective, but also from an environmental perspective, what happened was a tremendous change in environment. And it's not necessarily adding something toxic to the environment, it's taking something good away from the environment. So as soon as the river was dammed, it also created tremendous cultural change. So all of the traditional practices that were based on the river and on farming were taken away as soon as those dams went up. And what we've observed, at least the local traditional healers that I've talked to, they believe that a lot of the emotional and spiritual turmoil with the local people is based on that loss of culture and loss of self-sufficiency and a sense of dependence. And this loss of self-sufficiency, loss of culture, leads to things like identity issues and self-esteem issues and depression and anger. And unfortunately, the most common medication or self-medication for something like depression is alcohol intake. So not only have we seen a tremendous increase in diabetes based on damming the rivers, we've also seen an increase in things like alcoholism and alcohol-related deaths because of the loss of cultural context in the community.